ideas on how CSR can be a game changer. To take this very cause forward, I would now request our keynote speaker, Praveen Aggarwal, Chief Operating Officer, Swades Foundation, to share his thoughts and experiences. With 26 years of experience in business management and corporate affairs in large Indian and global organizations, he has been instrumental in institutionalizing stakeholder relations, risk assessment, CSR and sustainability practices. His professional experiences is associated with names like MGF, Tata Vehicles, Joint American Into Network, and Coca-Cola India and Southwest Asia. Praveen is also a member of CII's National Education Committee, Water Committee of FICCI, CSR Council of MCHAM, and all. We request you, sir, to please come and share your thoughts.
Thanks for giving this honor to be able to speak to all of you. My throat has gone slightly bad, probably because of frequent travel and I think the weather at Bombay and weather at Delhi. But I think as I continue to speak, it will be better. Excuse me in case you don't get some of my things that I'm going to share. And please feel free to make it a two-way dialogue instead of just a monologue. And I'm not too great a speaker. And with the kind of speakers that you had in the morning session, personally, I don't think I can have too much of value added into that. My talk, I'm not going to make any presentation. My talk is going to be around some of the experiences that I've had in last 12 years of my engagement in social development sector as part of the Coke team, and heading Coke team for CSR and sustainability. And now for last 1.5 years, heading a NGO which is trying to be a large NGO looking after 360-degree development. In my current role at Swades Foundation, we are trying to evolve a unique model of holistic development focused about water, sanitation, agriculture, livelihood, health, and education. So we are looking at full 360-degree deep-rooted engagement in almost 2,000 villages in rural Maharashtra that we are trying to work and make a direct impact on 1 million people with the aim that we can cause irreversible change into people's life and move 1 million people out of sheer poverty in a manner that they know the choices in front of them, they can have decision-making ability to select the right choices for themselves, and so on and so forth. I would begin with where Parul left in the morning about the need to collaborate. A great philosopher I heard about 6 months back in Mumbai. This was a UN program. So he made a startling start to his conversation where he said that, over the last 1 millennia, we have been living in a world which was more about consuming and competing. However, with the advent of 21st century and the kind of shared value creation that we are all talking about now, and kind of technology which has opened the world for us both in the physical sense and also in the virtual sense, I think we are moving more towards conserve and collaborate. From compete and consume to conserve and collaborate. I think this is going to be the theme for next 100 years or so. Friends, we've been talking for pretty long about the demographic dividend that India has been bestowed upon. I'm not very sure that we have been able to capitalize on this so-called demographic dividend. One of the youngest nation in the world, the largest young population, the largest population of the people in the productive ages. I think we have lost the big opportunity, or we are on the verge of losing this opportunity. Can we still retrieve this? Can we still ensure that we are able to reap the benefits of this demographic dividend? How can we do this? If a whole lot of our people are wasted, stunted, malnutrition, we are still known as blind capital of the world. We still have the largest population of anemic people, and anemia not because of anything else, but probably related to malnutrition and lack of nutrition. So is this something that we deserve? Is this something we are very proud of, or should we be ashamed? So these are some challenges, some questions that we need to deliberate when we talk about CSR, the partnership, what businesses can do together, etc. Major part of population doesn't get enough calories and enough protein. What could be the reason for this? Is it bad planning? Is it not working for the food security? Is it looking at food security as a different ball game, different from health and nutrition? Is it only because we have been talking of health in isolation and not talking about health and nutrition in the same breath? I don't know what is causing this. Our healthcare system currently is probably focused more on the curative part. We are not doing anything much or anything of substance about the preventive part of healthcare and nutrition. At our organization, we stopped calling our health vertical as health vertical. We want to call it nutrition and health because we realize, in one of our visits to rural Maharashtra, we were exposed into a 10th class environment and a small room totally packed to the brim, about 60 students sitting in the classroom. My having come from corporate background, I thought because there's a VIP visit happening, so the school authorities and my own team on the grassroots, they have prepared the classroom and got 60 people into that classroom, and these could be kids of 7th, 8th, 9th classes also besides the 10th class, which was supposed to be there. So I was slightly skeptical and also suspicious. I asked one young child who didn't look as being part of 10th class, Beta, what's your age? So this guy gets up 15. Another child, about 35 kgs of weight, 4 feet, 1 or 2 inches of height. Beta, which class you study in? 10th. What's your age? 16 years. You wouldn't imagine 60% of these kids in that class, they were less than 35, 40 kgs of weight. None had height of more than 4 inches to 4 feet, 2 and 3 inches. You could see patently they are wasted and stunted, if you believe that. And half of this class looked like students of 6th and 7th classes. What a wasted opportunity. And when we spoke to the block education officer, the taluka medical officer, etc., what we realized was that it's sheerly caused by nutrition-related anemia. Now, is there no solution for nutrition-related anemia? Can't we fight a basic deficiency of iron in our kids and mothers and young girls? So we checked out with people and we went to some of the dispensaries. They had the neatly stacked iron folic acid tablets, very neatly stacked.